Welcome to the continuation. The topic is bipolar disorder. So patients with the bipolar disorder may experience the emotions ranging from depression to extreme agitation. So bipolar disorder is nothing but characterized by the pathological mood swings from mania to depression. So what are the triggers first? What triggers the bipolar disease in anyone? Number one, insufficient amount of sleep. Now, altercations with the loved ones. Of course, alcohol and the drug misuse. Certain antidepressants and other medications also gives as a side effect of a bipolar disease. Pregnancy and other hormonal conditions. And a change in the seasons also sometimes give you the bipolar disease. What are the symptoms that we include? It includes the manic episodes and it includes the depressive episodes. So in the manic, a person feeling overly happy for the long periods of time, it's talking very fast with the racing thoughts, it's becoming easily distracted, it is having overconfidence in abilities, and it is engaging in the risky behavior, like gambling. When we talk about the depressing episodes, it includes the feeling sad or hopeless for the long period of time, significant change in appetite. Sometimes you want to eat more, sometimes you want not to eat, thinking about or attempting the suicide, feeling fatigued all day or the lack of energy, and the problems with the memory and concentration. So they both can be the symptoms of the bipolar disorders. Now, when we say we have a mania, in mania, decreased need for sleep, racing thoughts occurs, risky behaviors, distractibility. Depressive is again the feeling of worthlessness, appetite change, extreme sadness, and the suicidal thoughts. So mood stabilization in the patients with the bipolar disorder is accomplished with the lithium, which is the main drug, and the other drugs as well. So the mood stabilizers are what? They are moderate extreme emotions between the mania and depression. Lithium, which is an anti-seizure drug, which is also an atypical antipsychotic drug, which stabilizes the mood in the bipolar disorder. Lithium, that is traditional drug, but now in a combination therapy or just an anti-seizure and an atypical antipsychotic appears more effective at stabilizing mood, and the lithium effective for purely manic or purely depressive states. When we say about medications, anti-seizure drugs for bipolars are valproic acid and lamotrigine, atypical antipsychotics like aripiprazole, olanzapine, and risperidone. Then is the next attention deficit hyperactivity disorder. This is also one of the mood disorders. So it is a present challenge for children as well as in the adults, but more common in the children. Now, first, understand what is ADHD. ADHD is one of the most common neurodevelopmental disorders. Recent data indicates that up to 8 to 10% of the school-age children, they meet the necessary criteria for the diagnosis of the ADHD, which is Academy of the Pediatrics in 2001, they said it. What are the types of ADHD? Attention ADHD, child exhibits significant inattention across multiple domains with no significant hyperactivity or impulsivity. This is what used to be considered ADD. Another type is hyperactivity, when the child exhibits adequate attentional control, however presents with significant deficit with activity level and or impulse control. And the third type is the combined ADHD, which is the most common form in which the child struggles with paying attention as well as the regulating behavior. Population that has the ADHD is more common in the males than in the females. According to community and the pediatricians, the survey, the rate between the males and the females is actually 2:1. Now, the ADHD it can be an inattention. What happens, the symptoms, like the kids, the students, they often make mistakes in the schoolwork. They often has the trouble keeping attention on tasks or play activities. They often does not seem to listen when spoken to directly. They often does not follow through on instructions and fails to finish the schoolwork. They often has the trouble organizing activities, and they often avoids, dislikes, or doesn't want to do the things that take a lot of mental effort for a long period of time. They often loses the things needed for tasks and activities, for example, toys, school assignments, pencils, books, or tools, and is often easily distracted and is often forgetful in daily activities. Now, when we have a hyperactivity in which what happens, the fidgets with hands or feet in the seat when sitting still is expected, often gets up from seat when remaining in seat is expected, often excessively runs about or climbs when where is not appropriate. Adolescent or adults may feel very restless, often has trouble playing or doing leisure activities quietly, is often on the go and often acts as if driven by a motor, often talks excessively. Now, when we have a combined ADHD, it is impulsivity, that is, it often blurts out answers before questions have been finished, often has the trouble waiting one's turn, often interrupts or intrudes on others. So these are all the inattention and hyperactivity symptoms. Now, how the symptoms affect a child at home in the ADHD? It's difficulty following morning routines. It's increase in frequency of arguments with the parents or siblings, difficulty completing homework and daily chores, and messy and disorganized. In the school, it's difficulty remaining seated in the class, difficulty completing work in the timely fashion, and difficulty organizing materials. And the social skills lacking is difficulty regulating behavior on the playground, trouble interacting with peers, and difficulty waiting turns during the games. So now is the treatment. Research indicates that pharmacological treatment is the treatment of the choice for ADHD, and so we should focus is on improving attention and behavioral regulation. But there is a behavioral therapy as well, focuses on teaching the child behavioral regulation strategies to improve the frequency and duration of positive or the task behaviors, establish a reinforcement schedule as well. We modify the environment to focus on the child's strength and areas of concerns. And a parent and teacher can also do the treatment. They work with the parents to establish the realistic expectations regarding behavioral management and task completion. They help identify that the child struggles with attentional regulation and executive functioning in the clinical terms. This is all about the ADHD. Now, central nervous system stimulants, these are the drugs that have been the main course of the treatment for the ADHD. Key drugs to treat the whole things that we studied in the 3 videos, depression, bipolar disorder, and ADHD. So classification, their generic name and their brand names. Alpha-2 agonist, clonidine, antipsychotic, aripiprazole, acinapine, olanzapine, paliperidone, quetiapine, risperidone, ziprasidone. Central nervous system, CNS stimulants, amphetamine, dextroamphetamine, lisdexamphetamine, methylphenidate. Then we have the dual action antidepressants, bupropion, mirtazapine, and trazodone. MAO inhibitors is the phenelzine, phenylcypromine, divalproex, lamotrigine, lithium, valproic acid are mood stabilizers. Then we have norepinephrine reuptake inhibitor is the one drug atomoxetine. Then we have serotonin norepinephrine reuptake inhibitor SNRI, that's venlafaxine, duloxetine, venlafaxine. Then is SSRI, fluoxetine, fluvoxamine, paroxetine, sertraline. Tricyclic antidepressants, clomipramine, desipramine, doxepine, imipramine, maprotilene, nortriptyline, triimipramine, and tricyclic antidepressant is amitriptyline. So these all drugs are used for all the disorders that we studied in this video and the previous 2 videos relating to this. Thanks for watching everything.